I take the opportunity to welcome all of you. This is very important. Mental health is real. This morning, as I was listening to the radio, getting to the office, a middle-aged man was killed by a mob because he was found in somebody's compound and he was mistaken to be a thief. By the time the family members who were alerting the mob that this person is facing their mental challenges, it was too late. They had already killed an innocent person because of the mental health challenges. They are real. As Kenyans, as people, the time for action is now. And let's take the challenge. Allow me then to welcome Honorable Senator Kasanga. I know you have other functions, and thank you for coming to take the floor and share with us your thoughts on mental health. I know we have walked a long journey with you. In the last Senate, you were very instrumental in ensuring that we have a legislation on mental health. So as a commission, we thank you very much for that initiative, and don't be tired. Let's walk this journey and make a difference for Kenyans. Give a round of applause for Honorable Senator Kasanga.
All the other distinguished guests here present, I'm very honored to have received this invite. I don't take it for granted. I think this is probably the third engagement I'm having in regards to the new Mental Health Act. That's what it looks like. Somebody asked me that a title deed. I said that's how it looks like. Then there's the one that has the president's assent to it. And I say that this year's theme, make mental health and well-being for all a global priority, finds us in this country with a legislative framework on how it should be done. So in a way, we can give ourselves, a pat on the back for the work that has been done. And I always like to thank KNHCR, because without you, this journey would have been very difficult. You are central to helping the work that was going on in the bill. You are central to getting us, all the stakeholders together, collecting the thoughts, the ideas, the amendments, and everything was done by yourselves, and that I really appreciate. So KNHCR, without you, we would not be here celebrating this act of parliament today. So it was quite a journey, but it ended because it was God's will. It was voted on the last day before the Senate actually adjourned Cynthia. But that's how you know it was meant to be. This journey was just meant to be. And you'll allow me a few minutes, because I just want to give a highlight, because we have the media here today. I want to give you a highlight of this act of parliament. And actually, when you interact with it, you realize that there's a serious paradigm shift in how matters mental health are going to be handled in this country going forward. And it is important we all interact with it. The practitioners, people living with mental illnesses, leaders, all have to interact with this act so that we can understand really the rights that are hearing for everybody. And there are places that are so prescriptive, to the extent that there are penalties for things that are not done the way they're supposed to be done. That is how prescriptive this act of parliament is. And I'll just quickly run through, give you just a highlight of it for the purposes of media. This act of parliament is to provide for the prevention of mental illness, to provide for care, treatment, and rehabilitation of persons with mental illness, to provide for procedures of admission, treatment, and general management of persons with mental illness, and for other connected purposes. So that is how encompassing this act is. Now, on the first part, it gives the obligations of the national government and the county government. And it is very prescriptive on the role of each of those two levels of government. And whereas I can't go through each of them, I always like to concentrate on the role of the county. Because now our focus has to shift to what is the county supposed to do, considering that health and mental health is a devolved function. And in a country where we have such a huge gap in provision of services, we have such a challenge in terms of stigma. Stigma is the one deterrent for Kenyans to seek help. We have to fight these vices using the county governments, and we have to move from looking at mental health from an institutional basis to a community-based approach. So moving towards community-based psychiatry, which is the global best practice. So a lot of the tasks that are given here to the county governments, starting from first having a budget line, and I've already started engaging with COG to tell them that we need the CIDPs that are currently being done to have a budget line for mental health. That is for the counties that don't have already. And those that have, we are looking to upscale. We should be seeing changes now beginning to happen, now with the act in place. So besides budget, we are looking for community-based care in treatment of persons with mental illness, starting from the community level. So we're talking about community-based health workers and volunteers to be procured by the county governments. We are looking at the county governments to have county-specific programs to deal with mental health awareness, creation, and stigma fighting. All that is prescribed here. And by the way, just so that I can be clear, the Act says the county government shall. The word it uses is shall. So it's not giving them may, you may do, you may not. The word is shall. They must do these things. And there are quite a number of them that I can't go through each one of them, but I really encourage, especially media, you can highlight on each of these points because each of them are as critical as the other. The other very critical part about this bill is the rights of persons living with mental illness. I celebrate this because, as you know, we have the global best practice from WHO quality rights, and this bill has borrowed a lot from that. In fact, I think that was a lot of what KNHCR brought themselves, they brought into the Act of Parliament. And this Kenyans need to interact with it, practitioners need to interact with it, because failure to uphold some of the requirements by this Act actually have prescriptions for jail time as well as hefty fines, up to 5 million and above, or both jail time and fines. So the rights of people living with mental illnesses are highly described here, from the right to mental health services, which means you should be able to get physical and mental, medical health care, counseling, rehabilitation, and aftercare support. That is now included in this Act. There is, rights to consent of treatment. I can't go into the detail of that. There is a right to participate in treatment planning. This is something new. A right to participate in treatment planning, and where somebody cannot or does not have the ability, then the Act actually goes ahead to prescribe then what other methodologies can be used for that person to be able to participate in their right to planning. There is access to medical insurance. This one I like, because now nobody in this country can be discriminated because they're mentally unwell from procuring insurance or from their insurance that they already have, treating them for whatever mental illness that they have. That is now prescribed here, and the word used here is shall, and there is penalties for any offense for anyone who's discriminated against. Then there's protection of persons with mental illness. You know how we have our vulnerable people highly abused in many ways. Even in the workplace, you may be discriminated against or abused. You're not paid for your work or things like that, or those who are under the care of people, but they get abused. So that is also covered here. Then we have the rights to civil, political, and economic rights. So nothing stops you from exercising your civic, political, economic, social, and cultural rights as guaranteed under the Constitution. So that is also covered here, so that they can know they are full citizens and they should engage as such. The right to access to information is also included here. This I remember a lot of people living with mental illnesses fighting for some of these provisions, and now they're part of this Act. And of course, the right to confidentiality, the right to appoint a supporter. Decisions that are made by the supporter are also covered here. So you may appoint a supporter who goes rogue. That will not happen, because even what the supporter is supposed to do for that person is prescribed here in the Act, and there are penalties where that is not happening as to how the person wanted it done. Then of course we have the provision for legal capacity. I remember this, how some of the stakeholders here fought for this recognition of legal capacity, that a person with mental illness has a right to recognition before the law and shall enjoy legal rights on equal basis with other persons in all aspects of life. That is very critical. The Act goes on, of course, to talk about the mental health board. So that one is, and I'm sure you already know, we already have gazetted a mental health board, just waiting, I think, for the CS, so that you can commission them to start work. Again, the Act is very clear on who should be, and I'm glad that the appointments were done in line with in line with the Act, which is wonderful. And I know the chairperson, we have even met and sat down and started having a conversation around the work of the board. The Act goes into management of mental health units and facilities and looks into admission and treatment of persons with mental illness. So this is how prescriptive it is. Even for mental health units that are private, now they are covered under here. So there's regulation towards that. It is clearly prescribed on who can run a mental health unit. The mental units will have to be licensed and regulated, inspected. They will be required to submit reports on a monthly basis on various items, including data, because the idea here is to get data which we've not had. And penalties for fraudulently procuring registration for private mental health facilities. That is also covered here. So that is really good. There is very clear prescription in the Act today on matters of seclusion and restraint, and you know those are sensitive matters. And then lastly is the Kenya Defence Forces. This was one of the amendments that was done by the National Assembly by introducing provisions on how to deal with our men in uniform, our men and women in uniform. So the Kenya Defence Forces is covered. Their provisions are covered here quite in depth, beyond just the persons, but including their families as well, because we all know what they go through and how much they get affected by the work they do. So that tells you how comprehensive the Act is, and those are the various sections that the Mental Health Act has. And now I am just always calling on stakeholders that, like you say, CEO, the work has actually just started. We have a lot of work to do. We have work to do as mental health advocates, champions. We have to highlight, this Act and what it means for Kenyans in our different spheres of where we are all working on mental health issues. Any Kenyan should walk into a facility and get, services to do with mental health without discrimination or, what I mean. So I think that's it. That's it from me. I think that gives you a good idea. And they should hopefully elicit quite a bit of debate, but a lot more education, a lot more awareness needs to be created to do with what the Act describes going forward. So thank you very much, KNHCR, for giving me this opportunity. I really appreciate it. God bless you all.
Let me now call on Khatra Ali. Please come forward and make your remarks.
I'll quickly make remarks on behalf of the Council. National and county government actually present here, representative from various state actors, representation from various media house. The house is full of media. Friends and advocates of good health, Senator Kasanga, nice to meet you. We actually chatted on our WhatsApp, but on top of our phone, but we never met. So it's nice actually to meet you and she's really advocating for counties on what she actually mentioned in terms of actually budgeting the CITP for mental health. Ladies and gentlemen, and all protocol observed. In recent years, there have been increasing acknowledgement of the important role mental health on improving the health quality, life, and human development. Globally, this has been illustrated by inclusion of mental health in the Sustainable Development Goals. We know that many mental health conditions can be effectively prevented and treated at relevantly low cost, yet they remain to be a huge gap in terms of access of prevention, care, treatment, services for those who need mental health support, including in Kenya. On the overall, this is one area where effective treatment coverage remains extremely low. As such, let me take this early opportunity to thank KNHCR for organizing this strategic media sensitization forum for health and court reporters on mental health. This is definitely an important step in a correct direction. Thank you. So ladies and gentlemen, mental health conditions are very common. With 1 in every 4 persons affected in some point in their lives. There is even anecdotal evidence that this prevalence is increasing For instance, the proportion of mental cases reported on as proportion of the total outpatient visits shows an increasing trend in the last 4 years. These conditions have been mainly affecting our younger population, with 50% of mental disorders start by the age of 14 years and 75% by the age of 25. And are excavated by stigma and discrimination. I know Senator has mentioned that has been dominant. Mental health conditions do not only increase healthcare costs for individuals and families, but also put a significant burden to individuals, families, and communities. Depression, substance and alcohol use disorders are especially a burden in Kenya. In our daily engagement and through media reportings, we have witnessed low levels of productivity at workplace, families being crushed or wiped out of sometimes for loss of life because of mental health issues. What you were just told when the chair was actually having the opening remarks, somebody was innocently killed and people did not know that he's actually mental. And as such, mental health conditions pose a major health and development challenges for Kenya and its citizens. Ladies and gentlemen, despite this need, investment in mental health remains suboptimal in Kenya and around the world, with most governments investing less than 1% of their annual budgets to mental health. And that is why it's very, very critical. The Senator just said we are starting the journey now. So most often, the investment levels have not been commensurate to the immense burden and resource need for mental health. There are some gaps. There are also some gaps in terms of human resource and infrastructural capacity in regards to mental health at primary healthcare levels. Our mental resources have minimal capacity, skills, and tools to identify, address, or refer mental health conditions. On the other hand, at the higher level health facilities, we have human resource shortages. Remember, when you have a mental case, everybody, the first impression is like, we are taking this patient to Madare. So what is happening in the other level? So we really need to decentralize Madare itself in order for us to become governments. The cost is quite high, and we say if we actually think critically, we may even reduce cost in terms of referring such cases. As such, we need to increase investment on various fronts. We need to increase mental health awareness, addressing stigma and discrimination, increase access to quality of mental health care and effective treatment, and increase investment in research to identify new treatments and improve existing prevention and treatment methodologies for all mental health disorders. We cannot conclude this mental health discussion without noting that Kenya has, in the last decade, made some progress on mental health. From a policy perspective, the Kenya Mental Health Policy 2015-2030 provides overarching directions on necessary reforms and policy action aimed at strengthening mental health systems with a view to attain higher standard of mental health. This is in line with the right to health approach entrenched in the Constitution of Kenya 2010 and the Kenya Health Policy 2014-2030. The policy aims at ensuring that mental health is valued and promoted, mental health conditions are prevented, and persons affected by mental health conditions are treated without stigmatization and discrimination. The recently launched Kenya Mental Health Action Plan 2021-2022 also seeks to operationalize mental health policy and build a case for increased investment in mental health. And only this year, governments and partners work together to develop a mental health investment case. In this regard, we urge both the national and county government, development partners, and various private sectors actors to open an adaptive to financing this investment case, so the returns will make a long-term difference. Despite this, we have various areas that we need to focus on for improved outcomes in mental health, and I mention a few. Promotion of mental health and wellness programs, especially at community level, including the use of community health volunteers and community health workers. The focus now is on community health. Let us start from the grassroots, where we are always thinking about curative, but in terms of prevention, when we actually engage the community level, we can be able to mitigate some of the things that are actually emerging. Improving surveillance mechanism for mental health at all levels. Integration of mental health services at county health, education and social service level for increased access. Dealing also with stigma, which is very, very common. Stigma is always mentioned. And remember, when you have a mental case, it will not only affect that particular person, but the entire family are actually affected. Targeting groups, prisons, schools, displaced population, trauma survivors, and etc. The other thing is increasing availability of emergency drugs in county referral facilities, including mental health units. The other point is improving referral linkages between county and health facilities and specialized national mental health facilities like the Madari National Teaching and Referral Hospital, and then increasing budgetary allocation to mental health and well-being intervention. As I conclude, I wish to make reference to health in a holistic perspective of wellness in which mental health should be given a priority. As such, we embark on our walk of life. Let's adamantly advocate for mental health issues proactively across various populations. Finally, ladies and gentlemen, county governments continue to work with other stakeholders in strengthening mental health services. We are fully committed, and I say it again, as county governments, we are fully committed to provide the highest quality of health services, maximize opportunities to disease prevention, treatment, rehabilitation, and care, including in mental health. Today, most county governments invest over 30% of their total budgets in health, despite having 14 devolved functions. And that one is for fact, but we are always told to keep adding more. But remember, when you have 14 devolved functions, and you've allocated 30% of the total budget in that county, you continue increasing, then that means you are denying also our citizens. But we will work closely with partners and ensure that at least as much as we surpass the 30%, we are working with partners who are actually also investing in health. So we count on your partnership as you work in this journey. Thank you very much. Have a blessed day.